expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We're a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us at 954-717-7027. I am your host, Louise Gomez, and I am excited to invite we have today Dr. Armando Pineda Velez. And he is with Best Medical Center, and we're going to pull him on in a minute, and you can reach him at 305-362-1559, and he is at 928 Southwest 82nd Avenue, Miami, Florida, 33144. Dr. Pineda, are you with us? We're so happy to have you. Are you here? Thank you for joining us.
No, thank you for calling me and, to have this opportunity to talk to you.
Thank you, Dr. Pineda. We've been trying to coordinate this for quite some time, and I'm so happy that you're finally able to make it, and we're able to share all of your knowledge and information. And so I just wanted to share with the audience, if you can tell us a little bit about, if you can tell our listeners and our viewers a little bit more about your background, your experience, your education and training. And I know you have a lot of that, and so I didn't want to botch that up. I would prefer if you could tell us and share with the audience a little bit more about that, your background.
St. Paul said that humility is telling the truth about you and not adding and not taking. So I will be very plain with you.
Thank you.
I am Armando Pineda Velez. I'm an MD, certified in the United States here in Florida. I have 25 years only in Florida. But I did my medical degree in Mexico, and I did nuclear medicine, internal medicine, and cancer research in Mexico. I used to work for the two Nobel Prize of Medicine of 1977, Dr. Walter Shally and Dr. Yalow. One is for the peptides in the hypothalamus, releasing factor, and Dr. Yalow was the inventor of the radioimmunoassay that allowed for us, for the first time, to make peptides traceable, because before it was just a theory. We knew something, but we couldn't. And thanks to Dr. Shallow, Dr. Yalow, and Dr. Andrew Shally, we could do that. I had the privilege to work with them when I was a student. Then I followed when I was making my residency. Then I came to the United States, and I was working with Dr. Shally for 1 year in Tulane University, and mainly in VA hospitals in New Orleans. After that, I received an opportunity to go to work as a cruise ship physician, working there for 12 years, going all around the world. It was a nice experience because I got a lot of experience in emergency medicine and being solo, doing even small surgeries. Thanks God, I did a year of plastic surgery when I was in Mexico too. And that gave me a lot of experience. Then I passed my test in the United States, came in here, was at Larkin Community Hospital for 2 years. And then I decided to go solo because my children were going up at that time to the university. So I had to to start working for them.
Mm-hmm.
So then you remember I was with the American Academy of Anti-Aging Medicine.
Yes,
I did my,
that's how I met
yeah,
you. You
yeah,
were
I
doing
did.
some anti-aging. Yes.
Yeah, I did in there for almost 12 years, and with age management medicine also. Then I was teaching at the Empire Medical Center, and then I was teaching for Regenestem for 4 years too, teaching about stem cells. I did some courses in Korea with Dr. Lee and how to do autologous stem cells. And one of the things that I do mainly now is I'm a medical director in Best Medical Center. I have
Right.
three nurse practitioners working for me. They were doctors in their country before, so
Nice.
it's easy to work with them. And we have three offices: one in Miami, one in Hialeah, and another one in Chrome. But at the same time, I have my office working in research. I do medical research in two areas. And also, I continue doing anti-aging and aesthetic medicine, and also I do cosmetic surgery.
Wow.
I specialize more in face, neck, eyes. I do also BBLs, liposuction, and I really enjoy doing that, especially when I do faces. That's my favorite because I enjoy doing the sculpture and giving back 20 or 15 years, um, you know,
Right.
returning the clock back.
Well,
Yeah,
I have
that's
to
what.
I have to tell you, Dr. Pineda, I haven't seen you in many years, and I met you in person, and from what I see, you look about 10 years younger, and this is the truth. You look about 10 years younger from when I last saw
Yeah, I
you.
know.
Can you share with us? I don't know what you're doing. Can you share with us a little bit more about what you're doing?
Yes, if I thought surgery done on me, I did only my upper eyelids because they were in my family it runs
Yes,
the
me too. The droopy
we
eyelid.
call we call that's our Spaniards ancestors.
Oh,
Yeah,
that's what it is.
my family got this problem, so that's the only surgery that I have done in me. But usually, what I do, I take all my supplements,
Yes.
minerals, vitamins,
Yes.
some peptides, hormones.
Tell me about the
I do.
peptides.
Okay, there are different type of peptides. It depends what you want. In me, generally, sometimes what I do, and because I do everything cyclical, I don't stay too much in one treatment. I can do it for 2 months, then I rest for 1 month or 2 months, and then I go 6 months, or I can go. It depends. Like stem cells, probably I have done it since I met you, probably 2, 3 times only,
So you've done stem
and.
cells where? Just on the face or in a pair on an area in
I
the
do
body?
in, I do in my face. I do in my face. I inject it. I can inject it also in my fat. You can do that. In the United States, it's not allowed to do IV unless you are in RRB or you are in a university setting.
Okay.
But it doesn't need to be that.
Okay.
Usually, I do it. I have a case that
Yes.
really was very surprised for me. I injected his knees because he has osteoarthritis in both knees.
Right.
The guy didn't tell me that he had a COPD and
Oh,
he
okay.
was a smoker, because when I asked if he was a smoker, he denies it, because one of the class would say, do not inject stem cells or do surgeries in people who are smoking.
Really?
So
I
because
didn't know
he
that.
wanted to do the, yeah, because he didn't, because it doesn't work as much as we want. So
Really?
I did his autologous stem cells, and I injected like probably 100 million cells. And the guy called me 2 weeks later, telling me that he doesn't need his inhalers. So I say, "What you mean you don't need your inhalers?" I
Really?
say, you didn't tell me that you have asthma. No, doctor. I had COPD. I said, don't tell me. He said, yeah, the thing is, I'm going to be honest now. He said, I didn't want to tell you because I knew that you will reject me.
Wow.
And I said, and are you sure? He said, yes. And how do you know that you don't need them? I said, you know what? Today in the morning, my wife called me. We have a two-story house.
Yeah.
I was sleeping. He called me, Frank, come and breakfast is served.
Right.
So I just jumped from the bed, went down, sit down to eat, and when I was about to eat, I remembered that I had to do it first in the morning. So I went back, rushing. I went back
Right.
to the second story, and when I took them, I say, I don't need them.
This is amazing.
I say, what? Yeah. He said, really? I said, you know what, Frank? Okay, I believe you, but science is science. I want you to go to see your pulmonologist and tell him to do all these studies. Okay?
Right.
Tell him to do the pulmonary studies, at least a spirometry, so we will know. So the guy went to see his pulmonologist. He examined him, everything, did the spirometry, and everything was completely, perfectly normal.
This is amazing.
And I told him, this is really. I told him, this is really, really blowing my mind.
Yeah.
I say I cannot understand because I put it in your knees. How they migrated up there, I don't know.
So a lot of people who have, are like knee problems or different problems in the area, they're starting to hear now stem cells. Can you explain to people the process of how they extract the stem cell and the whole procedure and how long it takes? If you can share with us.
Okay, okay. I used to do a lot of what is called autologous stem cells. What this mean? I was taking either fat or bone marrow, process
Right.
it, and get only the stem cells from themselves. But what happened? If you are 70 years old,
Right.
there's a law in stem cells. It's called the thick law. That it means that you have only 60 times to multiply the cells.
Right.
After that, it's gone. So you have to take it 0 time when you are just born, when you are a newborn. But if you are 70 years, that means that almost all this time is already gone. So your stem cell will have telomeres that will be very small.
Right.
You are not going to produce a good stem cells for you.
Mm-hmm.
So now, mainly, I do stem cells brought from cord blood.
You do stem cell. Say that again.
Umbilical cord.
Oh, umbilical cord stem cell.
Yeah. Why? Because they are 0 division. So
Okay.
they are like you said, they are baby cells.
Understood. We're going to take a quick commercial break for a minute, Dr. Pineda. When we come back, we're going to continue with that conversation because a lot of people are curious and they want to know how that works. So we're going to take a quick commercial break. When we come back, we'll share again. Thank you. Hold on 1 minute, everybody.
Thank you.
Quick commercial break. Hold on.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
We have with us Dr. Armando Pineda Velez. He is at Best Medical Center right here in Miami. You can reach him at 305-362-1559. And at the location is 928 Southwest 82nd Avenue, Miami, Florida, 33144. Dr. Pineda, thank you so much for coming back on the commercial break. Are you there? Thank you.
Yes.
Thank you. So we were talking about, you were explaining to us about the benefits of particular stem cells. And if you remember, we can continue on that conversation.
Yes. As I was telling you, we use the umbilical cord stem cells.
Yes.
We have also access to exosomes. Exosomes is in reality the final products that the stem cells produce, and in some way are better. And because it comes from the fetus,
Yes.
you know, the baby, they are what is called naturally privileged. That means that they will not have any rejection. There's no history of any rejections to any person. It will work, and it will work in the majority of the persons. It won't work 100% the same way to another person, because it has to do a lot with the immune system also, or how your body will do this, and how the damage is. Okay?
Right.
Some person need only one treatment, but some other person need 12 or probably 2 treatments. I have patients that I've been treating, you know, for almost 3 or 4 times, and then they get set.
Nice. So,
yeah.
Dr. Pineda, I know you're at Best Medical Center, but I think you have a lot of exciting things coming down the pike in the future. Can you share with us what are your plans for the future? I know that we've spoken.
Because I want to settle down near my house. You know, we are moving to Hallandale.
Yes.
You know, I'm gonna be there always in Miami, because in there I just the director. I just give I'm just a leadership, but I want to work. I like to work with my patients directly. So we are opening in Hallandale, in the Atlantic Village. Is 801 Northwest US 1 in Hallandale.
Yes.
We are opening a facility where we're gonna do plastic surgery. I have one plastic surgeon. This is my friend is gonna be working with us. I will do cosmetic surgery. We are going to do cosmetic and also anti-aging and regenerative medicine, because I'm very interested in doing regenerative medicine, and you know, to give people, you know, how can we make the clock going a little bit backward, and also to recover some injuries. I have one patient that I really, and that's why I'm very interested, because this patient was about to receive a knee replacement.
Oh, wow.
The right knee replacement. He had like a 70 to 75% destroyed.
Wow.
The right side, and 55% the left side. And because he was working for almost 40 years as a steward, a bartender, he
Right.
has destroyed also,
Right.
the
Sure.
cartilage in the hands and the elbows and the shoulders and everything. So this guy used to come every month. That was 6 years ago, and
Right.
he used to come every month for 6 months. And I was doing platelet-rich plasma that I use also.
Right.
It can be alone or a combination. It can be a combination with stem cells, with Wharton jelly and other things.
Right.
And I injected him, and now you won't believe he couldn't even sleep in his bed because he will have fasciculation and tetanus and spasm of the knees and couldn't
Oh.
sleep for 6 months. But
Wow.
now he's 72 years old
Wow.
and he feels younger than before.
I'm telling
And
you,
no pain at all.
this is amazing. And so it makes sense because platelet rich plasma, PRP. Can you share with the audience a little bit more about what is PRP, and it's a simple procedure. Can you share how quick and easy it is with PRP?
Yeah, it's PRP has to be done by someone really qualified and know what is
Sure.
doing, because especially here in Miami, you find a lot of people that are doing PRP, but they don't
Yeah,
know what they are doing.
of course.
They don't have the tools or the knowledge how to do
Sure.
it. Like I can do it with tools and I can do it by myself because But you're talking about I have more than 10 years working on those things.
I know.
So I got some experience, and PRP has at least 7 different type of growth factors, who's
Okay.
gonna go and repair the tissue that is already gone, or the tissue that is in bad situation.
Right.
I don't know if you remember many years ago when PRP started. I think it was 12 years ago to be
Yeah.
famous, because PRP
Yeah.
is older than you think. The first
Okay.
person that were using PRP were the veterinarians. Then the dentists started using.
Oh, I didn't know
Then
that.
yeah,
Interesting.
then we started using in cosmetic. And
Wow.
since then, when the traumatologic and orthopedists got it, they were the last one to get it. And then the
Okay.
cosmetologists, okay, and dermatologists.
Right.
So at that time, I remember that this guy who was one of the best golfers, the Afro-American guy, I can't remember his name now, he had a sprained ankle.
What did he do?
And
Because I'm recovering from a sprained ankle. I'm listening. What did he do?
oh yeah, believe me, my son was he just registered at that time for the military, and then I told him, come, because he had only 3 weeks to go to the training, and at the university in UCF, and I said, come, I will do that, and then you go. It's gonna hurt for you for almost a week, and then you're gonna start recovering. And my wife was even mad at me because poor baby was suffering the first
Aw.
week. I did more damage to him, and I had to be listening all these rants, and then
Mm.
all of a sudden he said, "Mom, Dad, I'm going to the training," and he did perfect. He's
Wow.
now in the army, and then he's doing fine.
That's
It took only
amazing.
3 weeks and he recovered totally.
Wow. I'm going to have to see you for my ankle to get some PRP or whatever magic you do.
Yeah, PRP will do.
Wow. So, Dr. Pineda, we have 3 minutes left. I want you to share with the audience, from all your years of experience, and you have been in so many different arenas in the medical field. What piece of advice can you leave our audience with? What is the best way to take care of ourselves as we age? What do you suggest in the next 3 minutes? What tips and tricks can you share with us before we let you go?
Okay, this is a matter of fact. You eat healthy,
Yeah.
you get your supplements,
Yep.
You walk at least 3 to 5 times a week, at least half an hour. You don't need to run.
Right.
You can do brisk walking, and you almost gonna burn the same calories that if you jog without having any problem. Especially for people beyond the 40 to 50 years old, it's not very good jogging because that causes a lot of damage into the cartilage and the tendons and the ligaments. So you can do a brisk walking, walk in the beach also. Be careful.
Right.
Be careful, but you can do that. But if you got so vitamin D3
Yep.
from the sun or taken by mouth, you take all the B complex, you take all the minerals that you need. You know, because the agriculture in the United States has been industrial, most of our grounds really lack a lot of the minerals that our bodies need. So you need to buy something that is really comes with all the natural elements that has to be. Not because you see a tomato very very big or nice,
Right.
it means that it's good. No, you have to know where it comes from.
Yes.
You know,
Agreed.
so I will do say, don't eat so much carbs. Forget
Right.
about sugar. You don't
Yes.
need sugar.
Right.
Body produce sugar.
Yes.
Okay, you try to eliminate pastas and sugar in general. If you are from a European ancestor, you can drink milk, and probably you can eat some pasta, but not everyone. I
Yeah.
like there is a book of Dr. Quillen. It's curing cancer with nutrition, and I liked his approach to nutrition because he said that depending of our culture is the
Yes.
way we choose to eat.
This is true.
Because there is a lot of fat diets in there,
Yes.
a lot.
Dr.
But
Pineda, we're going to have you back another time because time has already flown and it's already 30 minutes. But I want to thank you so much for coming onto the show, and I promise you we'll have you back another time because you have so much experience and knowledge that you'll be able to share with the audience. So thank you so much for joining us, and we appreciate you.
thank you for this time that you offered to me. Thank
Of
you.
course, absolutely. Have a wonderful evening.
And God
Thank
bless
you.
all of the people that is listening to us.
Thank you so much. We appreciate you. Take care.